Again, there are behavioral treatments, but for severe cases of OCD, it's just very, very clear that interventions, which include SSRIs, which have been demonized. A lot of people say, oh, selective serotonin reuptake inhibitors are terrible, blah, blah, blah. The serotonin hypothesis of depression isn't true. Well, listen, the reality is this, that all treatments for depression that are effective, which include SSRIs in some cases, cognitive behavioral treatments, all of these sorts of things which have shown efficacy, are all about what? They're not about serotonin. They're about neuroplasticity. That's why some antidepressants center on dopamine and norepinephrine, others center on serotonin. They're about neuroplasticity. They're about changing neural networks. They're not about a neurochemical per se, but the neuromodulators, such as serotonin, allow an access point. They are a wedge into the neuroplasticity process. Now, with OCD, in order to overcome these malwirings, it's very important to get plasticity. How do you get plasticity? Well, in my belief, you work with an excellent psychiatrist who can prescribe the appropriate dose of drug to release the appropriate amount of neuromodulator. Then, and this is really key, you have opened up the window for plasticity, but then it's really important that the proper behaviors are engaged in. And when I did an episode on OCD, I talked about what some of these are. For instance, the person is exposed to the stimulus that causes the obsession, or maybe this obsession arises spontaneously. They feel the impulse to complete the compulsion, the behavior, and they resist with the support of a therapist, but they're doing this in the context of having elevated levels of serotonin or some other neuromodulator that then allows fewer trials of resistance, fewer times of needing to withhold the behavior that this person so badly wants to perform because it's coming from within as this compulsion, literally. Then they are able to achieve plasticity more quickly, perhaps also transcranial magnetic stimulation. So a conjunction of correct behavior, the withholding behavior, maybe a replacement behavior that's often used, use a replacement behavior with the appropriate neurochemical milieu is the solution to OCD.